Inevitably, with an International Liver Congress, viral hepatitis takes one of the sort of priority themes. There's lots of new data from the commercial trials on hepatitis C. There's some interesting data coming through also on hepatitis B, even though that's been a neglected area for some time. There's some new studies that have taken people's interest, I think, in hepatocellular carcinoma, primary liver cancer, and also some public health themes which I think are important. Some linking obesity and alcohol as a combination of factors that drive cirrhosis, at a societal level. So now we're in 2013, we're seeing a consolidation of the data around hepatitis C direct-acting antivirals. And so some of the studies and the drugs that were in phase 2 have now completed phase 3. And actually, by the time we get to the 2014 International Liver Congress, I expect some of those will be in clinical practice. What we've observed really over the last 5 years in drug development in hepatitis C has kept us excited all the way through. Of course, there have been some drugs that have gone by the wayside, either because of their side effect profiles or because they haven't met efficacy targets. But there's so many things going on in this field at the moment that the excitement is continuous. And the reason we're excited is actually because we can see it translating into patient benefit in a really quick time. I think from a patient's perspective, actually things have been improving constantly over the last 3 years. So we've been using for the last year in genotype 1 the protease inhibitors telaprevir and boceprevir. And for those patients, the success rates of treatment have increased at the cost, unfortunately, of additional side effects. Now we're moving into the next generation of drugs, and the patients within a year will see additional benefits. They'll get shorter duration of therapy, they'll get less side effects, and even better efficacy. So actually those translations are happening quite quickly. People perhaps misunderstand the situation with hepatitis C. When we talk about a sustained virological response, which means that the virus is undetectable 12 or 24 weeks after the end of therapy, we actually mean a cure. That virus has been eliminated. Now, if you follow those patients up, that means that they don't develop complications of cirrhosis, and their risk of developing primary liver cancer is substantially reduced. That's a cure. There's such excitement about the new drugs in development that is dominating the whole field for the time being. In the next couple of years, actually, investigator-led studies will come back into the forefront of hepatitis C research as we look at different combinations of drugs, the effect of antiviral resistant mutations, and the long-term impact of treatment. So hepatitis C treatment in the last 4 years has gone through an amazing revolution. So prior to that, we had just pegylated interferon and ribavirin, and the average treatment success rate was 50%. We're now looking at regimes going into market early next year where we can expect 90% cure rate from this infection. Furthermore, the new drugs that we are using will be suitable for patients who couldn't previously access therapy. So really, it's a brave new world for patients with hepatitis C.